Well, one of the ways that I work is with a multidisciplinary approach. I work with, the team. How it worked with. That's how I found it's worked the best with my own journey of endo, as well as the clients I've already worked with. And so the number one thing I always say is make sure that you find an advanced trained laparoscopic excision specialist. And the reason for that is that they're much more specialized. So they've done more training, and they do just that, rather than going and seeing a gyno or an obstetrician who do other surgeries. So they can do cancer, and they deliver babies. So they're not as focused on working with women with endo. And the surgery that the two types do is very, very different. Excision surgery is the best option for endo, and it gives them much more of a longer term relief. So the surgeons that I work with are those are more specialized. They've done the advanced training, and they use a method of excision. I'll make sure that along with this video that there is a link with the types of specialists and other modalities that I work with. Alongside the advanced trained laparoscopic excision specialists, I also work alongside pelvic physios, and not many people know about this type of modality. I don't know if I'll end up doing it justice, but essentially that they are specialised to work in the pelvic region. They do both external work and internal work, and the internal work works on pelvic floor tightness, because it's really common with women with endo, and or just women in general, that they can have tight pelvic muscles, and that can actually mimic endometriosis pain. So that is an important step, sometimes before surgery, sometimes after surgery. If women are still getting a lot of pain with sex, then it's a good option to explore as well, especially because surgery it's invasive and it's expensive, and you can end up having, you have to have time off work. So pelvic physio is definitely something to add into the mix to help manage pain with endo as well. I've had great relief with it as well. I refer my clients to pelvic physios. Highly recommended. Like I said, it can present things that they can help with. Number one is painful sex, pain with sex, also, or pain after having sex. Also, a lot of women with endo get a lot of hip and leg and back pain that is often sometimes resolved by chiropractic and physio and other modalities. However, it tends to stick around. So once you address the pelvic area with a pelvic physio, you can get a lot of relief with the other areas like hip and foot pain. I also refer to EFT practitioners, which is a technique, it's called tapping. It's a technique that is used for stress reduction, and also working on belief systems that we have that are keeping us stuck in life. So an example could be something like with women with endo, because it's a chronic disease, and I've experienced this personally as well, is that you get stuck in that thought pattern of I'm never going to be well again, or I'm always going to have pain. And so working on the EFT, or working with the tapping and working on that belief system, means that you can actually move forward and like live your life in the way that you want, by letting go of those belief systems. Because I know that for me personally, after all the journey of, the undiagnosed pain for the 10 years, and then I got the diagnosis and I got the surgery, and the surgery was successful, and I healed after the surgery, but there was still this thought that was stuck in my head of I don't trust my body anymore. I don't trust that it's going to do what it's supposed to do. And as a trainer and a naturopath, that's a very tricky, it's a very weird thing to feel like that, because it logically doesn't make any sense. But I just had so much pain and things over the years that I didn't trust that my body would do what it's supposed to do anymore. And so working on those type of beliefs really helped me with the EFT to trust myself again, and know that like it's okay, I'll be okay, and I am okay now. Yeah. In terms of modalities that I refer to the endo women to as well, to help with the whole management side of things, another really important one is a it can be a psychologist, and particularly one that works with pain. So I have a fantastic lady that I refer to, and she, you know, teaches women how to actually, I guess, pace. One thing is pace themselves with, in terms of pain, because you can't do everything. If you're in a chronic acute phase of pain, you just can't do everything. And so learning to pace yourself and understand and be a little bit more gentle with yourself helps with the whole management side of it. I've heard good results from the clients that I have referred to her and to other psychologists, is that they just learn strategies and techniques, and that's really important because endo is a chronic disease. It really has helped them manage it. Yeah, I guess, yeah, manage the pain and manage the symptoms and get on with life. I am part of a group of people that are part of an experts program, and we work on that team approach that I mentioned. So there's the advanced trained laparoscopic specialist, there is pelvic physios, pain psychologists, and naturopaths, herbalists, and we all work together so that you as a client or endo women can actually have that holistic approach. And if I'm not the right person for you to help you, then I can refer into that circle as well. For other things as well, there's PCOS specialists, as well as women's health, other areas of women's health and fertility as well. So we're all part of the team that can help you. Constantly learning, you know, supporting each other, and then referring as well, so that way you get like a good standard of, you get a good standard of care and a holistic approach as well. With women, when we think pelvic floor, we think Kegels, and so we go to do things to strengthen the pelvic floor. But in women that have tight pelvic muscles, that can actually make things worse, because it's like the muscles work the same as, you know, your bicep muscle, is that if you continue to strengthen it and it's tight, then it continues to stay tight. The issue is not the strength, the issue is the tightness, and so that needs to be addressed. And that's where pelvic physio can actually really, you know, it can really make a difference in things like painful sex and, you know, other symptoms, you know, other pelvic pain.